Thank you all for joining us for another Small Talks presented by the Think Small Institute. I am Cisa Keller, Executive Leader of the Early Childhood Quality Development, and I would like to welcome you all this morning. As people start to join in, we would love to see who is with us this morning. Please take a moment to click on the chat icon at the bottom of your screen and change who you're chatting with from host and panelists to everyone. And then let us know where you were joining from and what is your role or experience in the early childhood field. I would like to take a moment to thank all of our public officials and the Think Small board members for joining us. At the end of today's conversation, the panelists will be taking your questions. In order to help us stay organized, please use the question and answer icon at the bottom of your screen to submit your questions. Other attendees will have the opportunity to upvote if they have similar questions. As we're trying to rise above the traumatic experience of this past year, we realize we also need to turn our attention to the next pandemic of children's mental health, trauma responsive strategies for educators and families, and the effects of lost learning on the widening equity gap. It is my honor to introduce you to today's facilitator, Fred Sen. Fred is a founding partner of Fallon Worldwide Services, one of the world's most critically acclaimed and creatively driven branding companies. Fred's many roles have included Director of Account Services and later Chief Learning Officer, running Fallon University and guest lecturing at the University of Minnesota's Carlson School of Management. A native of Minnesota, Fred is very involved in local business and nonprofit organizations. Since 1986, he has directed the agency's pro bono efforts for the Children's Defense Fund. A past member of the Governor's Early Learning Council, Fred currently serves on the boards of Close Gaps by 5 and Think Small. Please welcome Fred Sen.
Thank you, Cisa. Good morning and welcome to the Small Talks event, where we're going to dive into a subject that we've all been thinking about. What is the impact of COVID on our youngest children, and how can we react to that? First, I'd like to introduce our four panelists and ask each of them to tell us a bit about themselves. Then I'll come back to each panelist and we'll start a round of questions. And remember, we want to get your questions as well. So type those in the chat box below. Let's start with Shirley Toby. She's a licensed family care business owner with 15 years of experience, and she has 2-star Parent Aware rated programs. Good morning, Shirley. How do you want to get started here?
Well, my name is Shirley Toby. I have been in the childcare business for about 15, 16 years plus. I love what I do, and that has brought me to a lot of places when it comes to taking care of young children. I love to teach. I love to see the stages where they grow from one stage to another. I love to see the impact that I have on their life. And so childcare is not only a place where you go to make money, but it's also a place where you go to impact life. So I really enjoy what I do, and I've been doing it for 15 years, and I look forward to doing it more and more. This is my passion. This is where I'm headed right now. Thank you.
Thank you, Shirley. Angela Kapp is a master trainer and owner of Midwest Child Development, and also a Parent Aware participant. Good morning, Angela.
Good morning, Fred and everyone. Thank you for being here today. I'm so excited. Yes, I have been in the field for over 30 years as a teacher, director, consultant, trainer, the NAEYC assessor, and I am just so happy to be here today to talk about the importance of mental health and caring for our children and providers. Thank you for having me.
Thanks, Angela. Next, Erin Bailey is the state of Minnesota's Assistant Commissioner on the Children's Cabinet. Good morning, Erin.
Good morning, Fred. Very excited to be here and have an opportunity to connect with all of you. As Fred said, I have the privilege of serving as Executive Director and Assistant Commissioner of the Governor's Children's Cabinet. That's a cross-agency convening around a children's agenda, partially, which includes child care and early education and a variety of priorities that we hear from children and families. So excited to be able to speak to some of the really wide-reaching whole family approaches that we do in my work. Just a little bit about myself. I'm originally from North Dakota, but spent most of my career in Washington, D.C., working on national policy level issues and working in the legislature there, and came back to Minnesota and have 2 young kids myself. And care deeply about the program that cares and loves them up every day and educates my kids. And so just really touched to be here and have the opportunity to speak with and learn from all of you.
Thanks, Erin. Dr. Gigi Chawla is the Chief of General Pediatrics at Children's Minnesota. Dr. Chawla?
Yeah, good morning, everyone. I'm very excited to be here as well. I think in this esteemed group, I'm representing healthcare. So from a healthcare perspective, I guess first I'm the mother of 2 daughters who aren't very young anymore. They're in college and graduated from college. But at Children's Minnesota, I lead our primary care clinics, our rehabilitation services of OT, PT, and speech therapy, and our behavioral health services. I also lead COVID testing across our organization at Children's, and doing all the planning, I guess, at this point for COVID vaccines. I'm also the state of Minnesota's medical director for Reach Out and Read Minnesota. And I guess since I have a couple minutes here, I'd just add that, you know, every day for the last 18 months, what we've had to do is reinvent healthcare to make it more accessible to patients and families and serve the kids that are in need, anything from mobile clinic and drive up, telehealth, and just anything that we can think of to combat the mental health epidemic that kids are facing. What I've really noticed is that we've had to lean further into public health than I ever thought we were going to need to be in that space. And the impact that I can see thus far on kids, being still in the middle of it, I do think we will look back one day and say that this was an adverse childhood experience for kids who are growing up. We'll see impacts for things like, you know, obesity on kids. You know, we've seen kids gain weight, and that lifelong obesity we know will translate to healthcare problems like heart disease, diabetes, et cetera, for the adult population. And then thinking about the developmental aspect of this for teens and older kids, that's really been a mental health crisis. For younger kids, it's been more of a social, emotional crisis in learning just how to self-regulate and develop friendships. And for families with younger kids, you know, infants to preschool, boy, they've had the hardest challenges, I think, trying to be a parent, a playmate, a teacher, a friend, and absorb all the roles that kids need. And that has been, I think, the most overwhelming thing for parents to have to face. So happy to take any of those questions and hear more about your thoughts as well.
Thank you. Shirley, let's go back to you. You're running centers. How did COVID affect your programs? And have children started to return?
Yes, the COVID really affected our program. In that way, it initially started, nobody really knew where it was heading. We were not even familiar with it. And so we started to do what we know how to do until it got to the place where parents started to pull their children out because everybody was frantic, everybody was afraid at that point in time. So the numbers started to reduce. And we started hearing, you need to do this, you need to do that, and we didn't really know what to do. So what we did, we didn't close. Our institution did not close because we had some essential worker children. And so we were told not to close. And so we continue what we usually would do, open daycare, take care of the kids and teaching and all of that. But the number had reduced so much that we could not do anything much other than just bear with the children we had there. We went down to 4 kids. Now, mind you, we were at 14 kids, but we went down to 4 kids and we could not close. And I could not tell my staff, you can work. So we tried to cut down hours to see how we can work, make do with all of us in that kind of pandemic. But it was very hard on us in the beginning. It was very hard. Now, talking about children returning, yes, we have kids that have returned. Now we are up to 10 kids, which we were not before. We had dropped down to 4, but now we have up to 10 kids. So you can see there's a progression down there. So yes, kids have returned. We have not reached our maximum yet to 14 kids, but yet we're up to 10. So we have 4 more to go.
Thank you. Yeah. Angela, talk a little bit about what you've done with training.
Yeah, well, I want to echo a little bit of what Shirley had to say about
Angela, you're breaking up a little bit. Can you hear me?
changes. So we've had a lot to lunch and I can, sorry, is it better?
Yeah.
My internet's better.
That's a little better. You know what I think I'll do is jump ahead to Erin, and we'll swing back and get you in a minute and see if it clears up. Erin, you've got the data on the COVID cases and their effect on children at the state level. What can you tell us about that?
Yeah, I'll just speak to, thanks for the question, Fred, at a really kind of high level, what we're seeing with regards to cases of COVID. And I think Dr. Chawla can speak to what they see in the systems and clinics as well. The Department of Health reports COVID cases on a weekly basis. That's a public facing report. I think many of you are probably familiar with it. There's a specific childcare page of what we see in programs, early childhood programs, and school settings as well. And we disaggregate that data based on age for children as well as race and geography. As of September 23rd, we have had nearly 135,000 cases in children under the age of 19, and about 18,000 in children between the ages of 0 and 4. So about 2.6% of our cases in children between the ages of 2 and 4. I will say, if you follow the news, you probably know the average age of cases is dropping. As we know, our kids are the primary unvaccinated population. We are seeing that case numbers tick up in younger children, and know that just Delta has proved to be much more contagious and infectious in young children. So we are seeing spread that looks quite different in settings, child settings, than we were previously. I'll say for children and youth under 19, the hospitalization rate is about 3.5% of those known confirmed cases. Of children who have had COVID, so that data point is of total numbers of hospitalizations. Of children who have had COVID, about 0.95% are hospitalized, so just under 1%. There have been 3 deaths reported in children between the ages of 0 and 4, and 2 between the ages of 5 to 9. I'll just touch briefly, specifically related to childcare, same number as of September 23rd. About 3,800 total childcare staff have been confirmed or probable cases, as well as just under 4,000 total childcare attendees. And many of you who were on our weekly and then monthly provider calls know that we tracked that data very closely. And early on in the pandemic, much higher rates of staff cases versus kids. And now that I think really in part by prioritizing vaccination for childcare staff sort of as essential workers ahead of just after healthcare and ahead of other population groups, we saw that those staff cases decrease, and now we see increased cases amongst children in terms of that breakdown.
Erin, you said September 23rd. Is that, you're talking about a week ago or a year ago?
Oh, sorry, a week ago. So that's cumulative data.
That's a stunning number.
Data.
Wow. Thank you. Dr. Chawla, you see a lot of what's called lost learning. What do we know about lost learning and the effect of COVID on children's academic performance?
Yeah, I think, some of the newest data that's come out from the Department of Education has really shown us that between 7 and 10%, there's been between a 7 and 10% decline in some of the academic testing for older kids across math and reading scores. Each year over the summer, I think we all expect kids to have a little bit of a decline, and then they pick right back up in the academic year. And so what we know is that potential is there for kids to make up from any academic losses. This past year was a real challenge with so much, virtual care, virtual learning occurring, and kids, there's a lot of kids who really didn't even log on a daily basis, and a lot of what we had seen is that disproportionately affected children of color, and so there's a lot to make up for, but I think we've had a lot of history to show that in small doses, like over the summers, kids can make that up.
Did you mention that you were working with Reading Corps?
I'm the state of Minnesota's medical director for Reach Out and Read Minnesota.
Reach Out and Read. Is there anything going on with Reach Out and Read that we should know about to help close that gap?
There's everything going on with Reach Out and Read. So Reach Out and Read is really a program that's focused on the youngest kids, and when they come in to their well child visits and healthcare provider, that healthcare providers really offer a book and help establish with parents how important some of the fundamentals of reading and bonding are into the development of a child, really helping families recognize that each second that goes by for a young kid, 1 million neural connections are made in the brain. And so laying the foundation for language and reading is so important. This past year during the pandemic, we have really focused on every opportunity to really support healthcare providers, helping families focus on what those fundamentals really are, offering books, being present, encouraging families that it is difficult to be everything to a child, but getting back to the basics of reading and bonding are really the key at getting our kids through it.
Thank you. That's really a critical gap that we've got to figure out how to back up and fill.
Fred, if you wouldn't mind, just to Dr. Chawla's point about disparities faced
Sure.
by children and families of color, I didn't mention in my data, but we see very clear disparities in COVID cases, specifically for Indigenous children and Black children in Minnesota. And we see really gut-wrenching disparities in hospitalizations in kids as well. The highest rates in American Indian and Alaska Native children, and followed by Black children. So just wanted to specifically call that out and appreciate her raising and apologize. I didn't lift it up earlier.
Thanks, Erin. Angela, let's see how your equipment is working there again.
Okay.
I'd love to hear more about your training.
Can you hear me all?
We can hear you. We can't see you.
All right, I'm just going to keep my camera off. Sorry about the internet connection. Yeah, our program, we really was starting to talk about the teacher turnover, and we have a lot of new staff within our program. I have 30 staff. And so we really needed to come up with a way to make sure that everyone had the training they need to be successful and to care for these kiddos. We had a lot of cases of challenging behavior, a lot of families dealing with stress, homelessness, food issues, all types of things. And so we currently have a weekly Zoom training with all of our staff, and then we have 4 all staff in service days. And recently we just had a training with trauma and child development. And our staff found that to be extremely useful in thinking about trauma in a different way, especially during this time of COVID. So it's been really helpful. And we've also introduced some things such as second step curriculum and doing a lot of individual coaching and working with our parent aware coaches, Center for Inclusive Childcare coaches, and our own internal coaches.
What's the second step curriculum?
The second step curriculum is a curriculum based on working through social emotional situations. So it might have a poster or a puppet in which you can share at group time and discuss and role play with children.
Thank you. So one of the things we're doing is keeping a list of resources which we'll make available to all attendees at the end of the session. Shirley, let's get back to you here. Anything else that other speakers have said that you want to comment on? How about relationships with families? That's a critical area that I'm sure you see.
We have had a very good relationship with families. I know one thing that we have done is that during the COVID time where everything was kind of up and down in the air, we met with our families and we explained to them that this is a disease that we have no clue of, and we will have to adjust ourselves because at a certain point in time, we came up with the decision, I think it was kind of national or statewide, that you could not come in the building and we have to keep kids washing hands. And when the parents come in, they have to wash their hands and they have to use the hand sanitizer. There were a whole lot of things that were, coming up in the air. So we had to explain to them, we had to sit down and have a conversation between we and the parents so that they will be able to understand where we are heading and then what is the purpose for which we have all these different things. One of the things that really grieved them was that they couldn't come in with their children. And we had a talk with them. A lot of times we just call them and talk with them because you just drop your kid at the door and you have to leave. So we had to really empathize with them and to also understand their plight, understand how they were feeling. You used to bringing your children in, coming in, giving the child kiss and all of that, and you can't do that anymore. So they had an issue with that, not really like an issue, but it was grieving them, and we had to have a serious talk with them.
Angela, can you comment on that same thing about your relationship with families?
Yeah, with trying to limit the amount of time that adults are spending in our building to prevent the exposure of COVID, we had to really up our communication in other ways. And so we tried several different communication apps, and we finally came up with one that's been working really well. It allows us as administrators to be able to see all the messages going back and forth, to chime in, and the teachers are able to communicate back and forth throughout the day and send pictures. And that's been really helpful, keeping that connection. When you're used to doing parent events and getting those get-togethers and having everybody together and hanging out and talking in the hallways, and you go to a very limited drop-off time, it's extremely stressful and hard on both the children, staff, and families. So we had to come up with some ways to really improve our communication, and that tool has really been helpful.
Thank you. And welcome back. You're on the air clear now. We got you.
Thank you. Thank you.
Erin, what's the state thinking about what the next steps for our reaction to COVID might be?
Yeah, I mean, I think as we think specifically related to children, My job is to sort of convene agency partners around the whole child. So as we think about impacts of COVID cases or quarantine, what does that mean for food access for a family? What does that mean in terms of access to mental health supports? What are unique barriers that kids and families might be facing to accessing services or being able to support their basic needs? And we know that COVID-19 has had a psychological impact on children and youth. There's pulse census data that we can track, and some colleagues on the Children's Cabinet Advisory Council, Dr. Gunner, has been a partner on sort of early childhood research specifically on impacts related to kids. We see symptoms of mental illness in kids and families, of substance abuse, the uncertainty of school closures. We've seen kids need to persevere sort of lack of activities or consistency. Obviously, a lot of frontline worker and sort of that trauma that childcare providers as heroes in the classroom are facing, and what that means for kids and families that they're caring for. And then just frankly, increased anxiety due to prolonged periods of isolation. And we've lived through and are living through, I should say, a racial reckoning of community tensions and unrest that's impacting kids and families as well. And so as we think about our strategies, we try to be able to hold the family at the center and work with our agency partners, agnostic of the system, but how do we come up with strategies of how to respond? Just to give you an example, as schools may enter a closure period or a childcare program, how do we wrap around and ensure that there's, like I said, food security for those families, that we're implementing PEBT systems so families have cash in order to put food on the table. And childcare has been an essential part of that. So we'll just mention a couple kind of high pieces that might be less well known. I think funding strategies and testing supports and those pieces might be more well known to the group, but through our preschool development grant and our partners at the Minnesota Department of Education and Department of Human Services, there's been work with the Minnesota Association for Children's Mental Health to create a trauma-informed toolkit that really focuses on healing-centered resources for those who work with infants, young children, and their families. And we're happy to share that out with folks here and with Think Small. And resources for parents that include podcasts and webinars and practical tools. The state has also supported the infant early childhood mental health system, which includes clinical services for children from birth to 5, training of over 3,000 clinicians in assessment and treatment of young children. And then the mental health consultation program I wanted to mention as well, working with about 60 mental health providers. I see Angela nodding. I know she might be familiar. So we have about 126 childcare sites that have been served, about over 6,000 children. And in total to date, about 221 childcare sites that have received that mental health consultation. And we know that consultation helps to reduce staff stress and turnover, to decrease mental health symptoms in younger children. It's reduced educational disparities and expulsion of children from programs, and increased learning staff competence. So I think those are just a couple examples of strategies I didn't mention just in total. Again, I think folks are probably familiar that the administration prioritized really early on in flexible federal money about $300 million investments in childcare, and is now in the process of implementing the new federal program, about $535 million in childcare investments through the American Rescue Plan, through childcare stabilization grants. And I'll just say that those programs, the pieces that have been most successful have been when the state has had flexibility to build those in partnership with providers, hear their feedback, and implement in that way. And so really grateful for that partnership. And you all are with kids every day, so you know a lot about what those policy strategies need to be. Thank you, Erin. Yes, if anybody has questions about resources out there, let us know now. As I said, we're going to put out a list of resources later.
Fred, can I speak to that mental health resource? Yes, Erin, I was shaking my head because we did take advantage of that resource in our program, and it was very helpful, and we're continuing to take advantage. You can call your parent aware coach or your licensor. Both of them have the handout that they can get you, so you can make that call and get that set up at and we're doing that for both our staff and our children and families. So we have first reached out back when we had some distance learning and had some children that were really struggling with that and going through a lot of personal stuff at home, which made, sitting in front of a computer very challenging. And that mental health consultant was really able to help that family and our teachers. So I encourage people to reach out and use that resource.
Thank you. I've noticed in the people that are attending, Justine Fitzgibbon is attending from Australia. So I think that's probably our farthest away. So we want to say hello to her, and then encourage anybody there to have go to the chat box and send us your questions. And now, Dr. Chawla, I'm going to ask you the question everybody's got in their mind. Tell us about vaccinating children. What do you know?
I think Pfizer has been the first of the COVID vaccines that we have available in the United States to start looking at vaccinations availability for kids 5 to 11. We do have Pfizer available for kids 12 and up. So looking forward to an emergency use authorization for those younger children. The data that Pfizer has been able to put forward so far makes it look like the studies show that it's very effective. It will be at a slightly decreased dose compared to the adult dosage and dosage that kids 12 and older have received. But there's still some steps before we can get to that point. So the steps will be that they've got to apply for emergency use authorization. The FDA has to review that data. And if approved, then CDC and committees like ACIP, the Immunization Practices Committee, would have to recommend that as well before our health department could say that we would also be offering that. With all of that in mind, at Children's Minnesota, we're already planning for that. We believe that, our oversight is about 100,000 kids that we cover from a primary care standpoint. And so we're already trying to figure out how do we meet that demand and need across our community.
Thank you.
I just add on, Fred, if you don't mind, that I just want to say to folks that the state is also like deep into planning for 5 to 11 with our partners, thinking about sites and community feedback of where families want to receive that vaccine, what is most accessible, how do we partner with our providers and pediatricians now in terms of educating and reaching to families. Obviously, Dr. Chawla is really ahead of the game, and I think we hear from families about that consistent talking point. For our 12 to 17 folks, we're at about 58% who have received a dose, I think, and just over 50 who have completed the series. So we've got work to do there too. But just want to make the point that we are planning very heavily to be ready for when that authorization happens, and then for 0 to 4 as well.
I want to jump back to the mental health grant question for a second. Amy Warsbach asked this question. She'd love to see the mental health grant be a continuing program since it was only available for 1 year. Now we don't have the resource. Who would like to comment on that? I guess it'd be you, Erin. Huh?
I think she's referring to the when programs can come in, and I'm happy to reach out on the back end and connect her with the right staff and leaders who work on the program.
Thank you. Any other questions coming in from the people who are participating?
Fred, there's a question in the Q&A from Allison, if you want to pop over there.
Okay, thank you. Allison Corrado, my child's preschool program is asking parents to test their children for COVID weekly and look for resources for free tests for families. What resources are available for providers to share with families to ensure families can access testing? Thank you. That's a good question.
I can take that. The CDC guidance does recommend weekly screening testing. I know many programs are doing it, and many programs, I'll say my own program does not have the capacity to do that. But that is what the guidance recommends. So there are a variety of resources. The Midwest Coordinating Center provides weekly testing to childcare programs and schools. Some programs have started to try that. It's a relatively new resource, federally funded. Those are swabs. that are done weekly. Additionally, there are resources through Q, which is kind of a rapid PCR test option. I think we are in the process of sharing out, as I said, some folks have already taken the information and run with it, but sharing out kind of more detailed information. And the state's community testing sites are up and running as well. So those are completely free saliva tests. They are somewhat more challenging for younger children, obviously. But I've taken she's 4 now, but she started taking her when she was 3, and she knows how to spit in a tube pretty well. So, and those results typically come back within 48 hours, oftentimes under 24. And then I'll just mention the state launched late last fall a testing program specifically for staff and childcare, sort of the first in the nation program that the state funded, that was weekly or bi-weekly screening for staff specifically. And developed kind of a way and process to try to do that testing towards at the end of the week to minimize quarantine and pick up cases. And I think from many programs that have participated, we hear like it is the reason they were able to stay open. It provided assurance and comfort for staff at a time when anxiety was really high, and assurances to families as well. So there are resources, I will say, at mn.gov/childcare. There's a special testing page, but our team is really happy to plug folks in and answer those specific questions around resources individuals are looking for. Also, to say the governor has been pressuring the federal government quite a bit around access to rapid tests, which I know continues to be a high need that we hear from families.
Yeah, it sounds like we're going to need an awful lot of inexpensive rapid testing beyond what we have right now, if as we go into the months coming up, where there's going to be more people who need testing. One of the things we've been trying to do here is to make sure that everybody out there knows what resources are available to them. Let's go through the speakers here and just point out services and resources that you think people might not be quite aware of that are important for this. Shirley, what resources do you depend on that you'd like others to know about?
Shirley, it looks like you're still muted.
Yeah, I was saying I would like to take this platform to say thanks to Think Small. One of the things that we have been doing, Think Small has been in the capacity of helping out with hand sanitizer, wipes, just all these little things that we need to use, get a hands cleaned up and be able to move on. So one of the things I would say, check with Think Small. Think Small has a lot to offer us, especially now, other than grant money and things. They have those basic things that we can use that you as a childcare provider will be able to spend money on. Think Small will be able to provide that, like hand sanitizer, wipes, and even Clorox, bleach, all of that. They have been able to give it to us. So that has been my resources that I've been using. That has helped me a whole lot in my program.
Thank you. Anybody else want to jump in on that one? What resources do you think aren't well known out there? Angela?
I don't know about not well known, but I definitely really appreciate the coaching that we receive from Center for Inclusive Childcare. It's really helped, even though they can't come into our program quite yet, they can still have those debriefing conversations with staff. We've been doing a lot of reflective practice. And so when it comes to mental health and working with children, it's a very stressful job. And so having those coaches to reflect back with is very helpful.
Thank you. I got a question here from Nancy Johansson to all the panelists. While SEL remains our greatest concern, we have been especially concerned with the impact on speech for infants and toddlers, as they are with math teachers all day. Any thoughts or advice? Oof, that's a tough one.
It's Gigi. So I didn't get a chance to give some of the resources that I tend to lean on a little bit. And it might pivot a little bit to this question as well. So one of the resources, or a couple of the resources that I'm especially thankful for, are Help Me Grow and Help Me Connect, to really ensure that families and caregivers and clinicians all know how to access the services that kids may need. And I think, you know, things like speech therapy and others can be a connector to help get kids some of those very needed services. I think the other piece that I really lean on and I'm so thankful for is the National Suicide Prevention Hotline. You know, we've really seen quite a dramatic increase in kids who unfortunately have come to our emergency room in acute mental health crisis. Our rates are, you know, 30% greater than they have been, and needs for placement for inpatient mental health, and that demand has skyrocketed. So really thankful for those. But to answer directly the question about masks and speech, you know, I think it is a real challenge, especially for young kids who need to be able to not only hear, but see how language is formed by watching mouths and tongues. But again, kids are super resilient. And so, you know, they're not wearing masks all day long. They're wearing masks at times where they're in group settings and with those that aren't their loved ones. And so, you know, I think just really keeping that perspective as well. At Children's, we've really leaned on an aspect for some of our speech therapists as well, where they are clear masks. So they've got a clear shield. So specifically for kids who are having articulation difficulties or involved in our speech therapy, we do have masks where our speech therapists can have that window so that they can teach kids a little bit easier. So hope that was helpful.
Thank you for that. Ashley Lindback asks this: can the providers share impacts of COVID closure on their business? How is this affecting working parents and their families? I'm not sure exactly what Ashley means by COVID closures. Are those the businesses that are limited to vaccinated people or not?
Fred, I can speak to that a little.
Okay,
So
yeah.
whenever you have a positive case of COVID within your
Okay.
childcare program, you need to close your program or classroom depending on who has had contact. And our program, we have 4 locations. One of our locations closed 3 times so far in the past year for a period of a week or more. When that happens, we don't typically charge the parents tuition, and thus puts a big financial strain on our business. We're losing, our last closure cost us about $15,000 as a program. And that infected payroll. How can we pay these staff? And those staff depend on their pay rate for their families, and which makes it stressful, and thus it's stressful on everyone. So we have really, as a program, been taking a look at how we're going to move forward. The new grants, it is a requirement that you do keep all your staff and have a 70% increase in pay and benefits. And so that is a really challenging situation for a lot of programs. So we've really had to take a look at some of our policies and make a decision whether we're going to allow any unvaccinated staff, whether we're going to keep wearing masks. All of those things have been a topic of conversation within our administrative team.
Anybody else want to jump in on that one? Sounds like we're staying away from it. That's a really tough one. It's going to get tougher too. Here's, one of the things we're trying to do is trying to figure out how can we best react to all of this. So the question I'd have for everybody is, what are the lessons that you've learned in the last 18 months? And where do you find hope? Shirley, you want to start with that?
Yeah. One of the lessons that I've learned over the last 18 months, and I had to take I had to sit back a little bit to look at myself. Before the pandemic, when I was doing childcare, I saw myself as maybe taking care of the children, making sure they are taught and all of that. But after the pandemic, I saw myself in another role. I saw myself as someone who is not just taking care of children or as other people who see it, but I saw myself in a role that is very strategic, in a role that is very important, because parents could not do without me. I saw that clearly. I saw that parents needed me to be able to go to work, to be able to move around and to get things done for their family or even for themselves. And when that happened, I had to sit back and I had to think. And I had to kind of put my mind together to be able to see myself differently from what I usually did as a provider. And that is something that I would like for all of us providers to just take from this, that we are not just caregiver, we are not just taking care of children. We are so important in a society that the economy depends on us, because we have to take care of the children for parents to be able to work. And so that's one of the important things that I've sat down and I've thought about and I've seen myself. And because of that, I've looked at the job that I'm doing now in a different way than what I did before.
That's really interesting, Shirley. It's a very interesting thought that all of us should reflect on in this as we come out of this. Angela?
I don't know if I can top Shirley there because she pretty much nailed it. But yes, and to think about the resiliency in the children and the staff, I have a great team and they have continued to work hard under, in normal circumstances, it's hard working with children. You work pretty much straight through. You have to keep your eyes on those children at all times. You have to maintain ratios. You don't just get to step out and have a break whenever you want. And during COVID, it's been especially hard and our staff have just really stepped up and come to the plate. So, they deserve our recognition and our support. And I just hope that this situation has really opened the eyes of the, public and of the politicians to think about how important early childhood is to our society. So thank you, Shirley, for your statements.
I couldn't agree, Fred, if you don't mind, I'll jump in. And I couldn't
Sure.
agree more with Shirley and Angela. And thank you very much for your comments. I think what gives me hope is seeing leaders and providers and educators like them and their teams working with kids and families. And I think the last year has taught us and many of our state systems about how important that rapid feedback loop is, what that partnership looks like, and how to give each other grace and care about our communities together to help solve problems. There are a million things that I think about, like hindsight 2020. Would we have done that the same way again? But the fact of the matter is we were operating with the best information from science and the best information from Minnesotans at that time. And we were able to adapt and respond as a result of the resiliency of kids and families and the strength and love and brilliance of our providers and educators and those who care for our kids each and every day. So a lot to learn, and I think a lot of lessons that I hope to take with me and carry in our work of hearing from community and hearing from leaders and hearing from providers as we move forward.
Thank you, Erin. Dr. Chawla?
Yeah, I think there's a lot that gives me hope. The first is panels like these. You see early educators, schools, policy, healthcare, all massive systems working together to try to find a way to solve problems. And though I would love to say we did that before, we didn't really. And so this is that gives me a lot of hope to move the dial. And then I think the thing that really, I guess, gives me pause for how hopeful we can all be is that I really think this has been just an amazing journey for all of us to see what has been really important in our kids and in our families' lives. There were so many things that we were doing before, racing here and there for different sports and different activities, and we were trying to do too much, honestly. And so this has just given us all, a little bit of a pause button to say, what are the most important things that we do? How do we do them? How do we do them well? How do we prioritize those and just, focus on family and strength? I would say that the other piece that we might have missed today is how important grief counseling is for kids. We've had a lot of deaths in the state of Minnesota, unfortunately, and each one of those come with whole family lineages. And so kids have really had to learn about death and death of loved ones and take that with them as well. And so I think that's been another learning, at least for me personally, is how important building some of that in has been for kids as well.
Thank you. Last chance to get your questions in now. I've got one more question that Erin, I'd like you to start with and then see where it goes. How can early childhood educators and others in early childhood field get involved with the state efforts around COVID-19?
Well, I would say many are. We have many phone calls and emails with folks, and I think my agency partners at Education and Human Services and other places are health. I'm talking to providers each and every day, and that feedback is enormously helpful and heard. I would say there are also numerous sort of formal processes for providers to engage. I know some of you are familiar with the Great Start for All Minnesota Children Task Force, and those applications are open, and I've appreciated seeing those pieces come in. We have numerous advisory councils. We try to share out these opportunities in the Children's Cabinet newsletter and compile those opportunities with the state. And then I just say, on a really less formal way, the emails and conversations are the ways that we've built strategies. Shirley talked about the supply chain. That was us on the phone with Think Small, dedicating resources and purchasing, securing private donations initially, and then funding that supply chain. And that real-time feedback and open communication is critical, and I appreciate it. And that I know that many of you connect with your licensors often, and we've tried to sort of more seamlessly ensure that communication is lifted up, and then in the various policy and intervention strategies that are being developed. And so really encourage you to leverage your coach and your licensor as a communication point and to provide feedback as well.
Anybody else want to jump in on that one? Dr. Chawla, I've got another one for you. What factors would increase a child's risk of developing mental health problems during a pandemic? And what age groups are most vulnerable?
I don't know that I've seen an age group that isn't vulnerable, honestly. So I think the effects are everywhere. I think the place to make the biggest impact is in younger children. As far as the factors, the factors really are around the health and the well-being of the adults who care for the children. And so really ensuring that, if a parent or guardian is struggling financially with their own mental health issues, that has a ripple effect to children and their own mental health.
Thank you. Any other questions coming in?
Yep,
Fred,
Fred, there is
go ahead.
one in the Q&A from Diane and a comment from Christina.
I saw that one from Diane, and I'll read it, but I didn't understand what ACE is, what ACE.
Yeah, I can take that one,
Okay.
Fred. So ACEs are adverse childhood experiences.
Okay.
And we know that research has shown that as children experience a greater number of adverse childhood experiences. It has substantial ripple effects, not just in things like mental health, but also in physical health. So increased rates of cancer, diabetes, obesity, other aspects of health. And I think we're in the middle of this pandemic. We assume that this will also become an ACE or another another tally mark that is an adverse childhood experience. Children's Minnesota is the effector arm for the University of Minnesota in some of the research with the Harvard Center of the Developing Child for adverse childhood events. And so at Children's, we do the assist with the research for patients on cortisol testing and measuring what toxic stress could be. And so we are looking at our research. I think everyone is really just at the nidus of that, Diane. And so it's going to be a while before we can really organize ourselves scientifically to understand what that impact has been.
Thank you. Shirley, I've got one more question for you. Can you share some of the experiences of talking with children about COVID and how they should stay safe?
Yeah. Yes, what we did at our program is that we were very real with the children. We didn't sugarcoat anything. We sat them down in one of our, circle time where we all sit on the floor and get comfortable, all of that. And we told them about this disease. And we told them what we can do to help ourselves with this disease. But then we also told them that you might be losing people from this disease. And so they were asking questions like, what will happen? I said, well, if somebody probably doesn't wash their hands or do something to protect themselves, put on the mask, or they were asking why we have older people with the mask on their face, why the parents wearing all of that to come, to drop them off and all of that. So we sat them down and we talked about it. And we told them it's there to protect the bowels from cough or anything coming from somewhere or from them going out to someone. So we had a conversation and we talked to them and the things that they need to do to help this, like keeping mask over the mouth and washing hands, hand sanitizer, all of that. So we were very real with them. We sat them down and we told them exactly what we were getting from the CDC and other health people, how we should go about with this disease. So when we explained to them what was going on and what could have happened, they themselves started taking precaution. When someone coughing, they will call me, oh, Miss Shirley, this person is coughing, and then we get the kid mask and put it on there and then see how they go. Another thing they were asking about is the temperature thing. We were doing temperature every day when they come in. So we were not doing temperature before, but then we started doing temperature when the COVID started and they got confused. So we had to tell them that we were doing the temperature thing to make sure that someone is not developing temperature and they're not experiencing something COVID related that we do not know about. So it was a way to check everybody in the morning to keep everybody safe. And so that started to relax them a little bit. They will come in the morning and they will pick them up from the vehicle and immediately they will walk to where we're supposed to go to do the temperature check and all of that. Even some kids will remind me, oh, Miss Shirley, John Brown didn't get his temperature check, So they were all conscious of that and they were very particular that we did those things every morning.
Yes, a routine that would really help. We've got one question coming in and I'll stay with you, Shirley. The question is coming in from Tiffany Grant. Are there supports and resources for families looking for mental health providers of color?
That is a tough one. I really do not know about that. But what I would say is that we are all using the same resources like Think Small and getting information from CDC and I think it was everyone that spoke about some mental health group. So I haven't heard about any mental health group that is just responsible for Black children or that can be able to help Black children. I think we all using the same material that we have. Anyone on the program can jump in and help me out with that question.
Great.
I
And go
I
ahead.
can speak to that really quickly. You know, I think it's just to be open and honest and clear with the people that you're getting your support from, and if it's not the right match. And so we found the right match for our family who was going through homelessness, family of color, and they found a therapist of color, and it was a good match. So if it's not a good match, we just need to speak up.
Great, thank you. Any other questions? We've kind of reached that time of the morning where you got to go fill up your coffee cups and go to work. Thank you very, very much to all 4 panelists. I want to quote Shirley to end this because I think she gave us the thought we want to put in stone, and that's parents need you. And the way Shirley describes it, it's a much bigger, broader, deeper need than we might have perceived childcare in the beginning. So tough times, you folks are doing a fabulous job. And thanks very much for joining us this morning. Anybody else, any comment from the group?
And then I can close us out
Yeah.
here because I know we are at time. Thank you so much to our esteemed panelists, Shirley Toby, Angela Kapp, Erin Bailey, and Dr. Gigi Chawla, as well as our absolutely fabulous moderator, Fred Sen. You've provided us with useful insights into the impact of COVID-19 into your programs, the physical and mental health effects on children, educators, and families, and shared resources that leave us feeling hopeful for the future. Again, I want to thank our public officials, Representative Carly Katunwa, Representative Kelly Morrison, Senator Melissa Wicklund, in addition to Think Small board members, Andrea Sang and Andrea Stern, as well as past board member Bud Hayden for joining us. We'd also like to thank our philanthropic partners at Blue Cross Blue Shield, the Richard M. Schultz and Sheltering Arm Foundations for their ongoing support. Finally, we'd like to thank everybody in the audience for joining us today. We are excited to see participants from Minnesota, all across Minnesota, in addition to folks from Indiana, Florida, Louisiana, Massachusetts, New York, North Carolina, as well as Australia, Canada, Germany, and Mexico. I urge each of you to look at the handout of resources that will include information to help you continue your journey on how to support young children, families, and educators. This resource list contains information on mental health services and supports, Red Leaf Press reading recommendations, Think Small Institute instructor-led trainings for educators and families. We're also excited to announce that Think Small Institute will be launching a 2-hour e-learning course called The Trauma of COVID-19, Children's Mental Health in the Aftermath of the Pandemic. This will be launching next month. It explores how COVID-19 has left children suffering from ACEs, adverse childhood experiences, and explores how early childhood educators can support young children and their families in the aftermath of the pandemic. If you're also not receiving the Think Small Policy and Advocacy email, this is a great way to update things that are going on in the early childhood policy news across Minnesota and across the country, events, and receive additional resources. Again, thank you so much for being here, and be sure to join us next time for our next Think Small Institute Small Talk event. Thanks, everybody.
Bye-bye.